All right. Hello, and thank you for joining me, or us, and everyone. My name is Denetra Lee. I am a licensed professional clinical counselor and a clinical therapist with the Department of Behavioral Health, Workforce Education and Training Program. If you are viewing this video, that means that you are interested in learning about San Bernardino County's LPS involuntary detention process. Perhaps you're interested in learning about some recent legislation that has taken place that has significantly impacted that process, or you're here just because you stumbled on the page. So either way, welcome. I will be covering a lot of content in this presentation. However, it will be recorded in sections. And so I hope that you get the information that you're looking for. And if not, there will be some resource information where you can ask further questions or possibly locate or identify the information that you still need or in search of. I should note here that this presentation is intended for educational purposes only. These slides are used as part of the county's certification training for individuals who are looking to become certified hold writers. However, that process is a structured process. So if you are viewing this and you're interested in becoming a certified hold writer, you must consult with your agency's point of contact regarding your eligibility. Just by viewing this video does not certify you, does not qualify you, does not make you eligible to be a hold writer or, allow you to write 5150 holds. Yes, a good portion of these slides is part of the training, but there are additional elements that are not presented in this video that our hold writers, or rather our certified hold writers, need to acquire. So again, just by viewing this video does not certify you or does not permit you or allow you to write 5150 holds. However, I will encourage, in addition to viewing this video, that you read the entire Welfare and Institutions Code 5150 and 5585 in their entirety. The entire code will not be covered in this presentation. However, the most significant and critical components of the code will be covered throughout. But it would be a good idea for understanding, for more context or in-depth context, to read the entire code. But for this presentation, we will be covering the San Bernardino County Lanterman Petrus Short, or LPS designation. We will be covering, the LPS Act history and intent, California's legislative timeline. So again, especially within the last 5 years or so, there have been several changes to the LPS Act. And what has happened is with these different bills and the different legislation that has occurred, how the LPS, the original intent of the LPS Act, has sort of been built out, right? And how it's reflected in our state, and then how our county also adheres to those guidelines. We will be doing an overview of the LPS 5150, 5585 process. I will be covering the involuntary detention criteria, the legal criteria one has to justify in order to legally detain someone involuntarily. The patient's rights video will be available separately from this current presentation. Our patient's rights team will cover all of the topics under patient's rights. We will also be discussing some detainment considerations. So there's several sort of adjacent topics in terms of detainment and what should be considered. And then I'll also go over some frequently asked questions, sort of like a short overview or a short review of what we've covered. And then lastly, there's several pages of resource information. So just several resources of organizations or agencies or programs that are available throughout our county that you may want to or you may need to get in contact with. So I will be covering those slides as well. And without further ado, I want to go ahead and just go over what are our objectives for this presentation. I have to try not to say training. This is a presentation, not a training. We will be reviewing, again, the history of the LPS Act and the patient's rights movement with regards to severely mentally ill individuals. We will provide an overview of the process, of the assessment process, rather, We will discuss the criteria for a 5150, 5585 assessment, and which includes danger to self, danger to others, or gravely disabled. You may see the acronyms DTS, DTO, or GD. That means those are the shorthand versions of the legal criteria. And lastly, we'll discuss what happens before, during, and after an evaluation and then the related processes involved in involuntary detention. What I need to also point out here is that this presentation covers California law. So what the state law permits and what our state law requires. So it's often that there will be questions that will come up in our trainings about, okay, well, what if this happens, or this individual under these circumstances, what do we do? So questions like that, as much as I would like to answer them, because this training is specifically intended to cover California state law, individual organization or agency specific scenarios, those types of questions with regards to, policy, procedure, standards of care, during our trainings, I would have to refer those individuals to their own leadership as to how they would handle that situation. So essentially, this training covers what the law says, how individual organizations or agencies carry out that law is up to those individual or agencies. So I'm sure there will be questions that maybe you have as a viewer. So I just want to make note of that here, that this training covers specifically what the law states. And granted, the law can be a bit vague at times, which is why it is up to those organizations and their policies and their procedures about how their system would carry out certain steps to make sure that they adhere to the state law with regards to involuntary detainments. So without further ado, we'll go on and get into our section 1, which is covering San Bernardino County LPS designation and what that looks like within our county. So first, looking at automatic designation, by law, peace officers are designated to write 5150, 5585 holds just by way of their role. So the previous trainer would say if they have a gun and a badge, they're designated automatically. So all of the individuals here listed are automatically designated to write 5150, 5585 holds. They are not required to be certified or to go through a certification process like individuals such as myself are required. The county does presentations and overviews, and sometimes some trainings for our law enforcement, for our sheriffs, specifically as of late because of some changes with the legislation in this year. And so there's been need to kind of update them on what has changed and how that impacts their role and their responsibilities out in the field. However, it is just important to note that our peace officers are automatically designated because they are peace officers. With regards to who can be eligible if they're not a peace officer, we have a whole list. You must be either a licensed professional, or the individual that is interested in becoming a certified hold writer must either be a licensed behavioral health clinician, an unlicensed behavioral health clinician, so an associate, and under certain circumstances and certain locations or regions, a licensed psychologist, a registered or waivered psychologist, a psychiatrist, a psychiatric or mental health nurse practitioner, or a registered nurse. So these are the professions that are eligible to become certified, but also, again, must go through the certification process. Who also may be authorized are mental health professionals designated by San Bernardino County, designated members of San Bernardino County Crisis Systems of Care, persons or in charge or members of the attending staff at an LPS designated hospital, and then hospital emergency room department staff. So with regards to designation and what that looks like, who is certified to write an application for detainment and within our county? So again, of those professionals, a licensed or waivered professional designated by San Bernardino County Department of Behavioral Health who complete the certification training and pass the associated test every 2 years. So individuals who are identified as folks who are eligible to become a hold writer must go through a 3-hour certification training, and then take a test and pass it to become certified, and then recertify every 2 years to maintain that certification. They must also sign and submit an attestation, essentially agreeing that they will comply with the Welfare and Institution Code requirements. And there's a list of agreements, such as I will offer voluntary services first whenever appropriate. I will always consider the least restrictive environment for those in need of mental health services. I will indicate my control number on each hold after my signature, and the control number is a number that is assigned to a designated, a certified hold writer. So that it's almost like a social security number, honestly. It sort of identifies the hold writer within our tracking system. They also agree to provide appropriate referrals and resources when a hold is not needed. And I will cover appropriate and inappropriate holds in a moment in our training. And I reiterate that throughout our training, one, because it's a legal requirement to offer voluntary services, but then two, it's always important to do an appropriate assessment, because there are times when maybe a hold is not necessary, but intervention may be. And so there's some other steps that can be taken. And they're also signing that they acknowledge that their authority to write a hold may be revoked if they do not follow the guidelines of the Welfare Institution Code, or if their license expires or gets suspended. And so they're basically agreeing and signing the statement saying that they understand this and they will agree to all this. They're also agreeing to provide all the copies of the applications that they've completed for review, for data collection, and for feedback. And then as of late, that those applications are being reviewed also for quality assurance. It's a couple of things that are important to note here, where our peace officers can write holds to any designated LPS facility, county designated professionals. So the individuals who are certified can only write applications for detainment to San Bernardino County LPS designated hospitals. And there's only 5 in our county, which I'll go over in a minute. So even though our certified professionals are able to write holds, they're limited to writing holds to only 5 locations in our county. Another thing to note here, APS workers, or Adult Protective Services workers, Department of Children's Services workers, or conservators, they may not write holds unless they're designated under a different umbrella. So unless they are certified in some other role. So with regards to our designated hospitals, there are 5, again, in our county. We have the Community Hospital of San Bernardino and Jerry Pettis Memorial Veterans Hospital. These 2 accept adults only. Arrowhead Regional Medical Center, or most may know it as ARMC, they accept adults, but it's our understanding that their adolescent unit is in development. Canyon Ridge accepts adults and adolescents. And lastly, Loma Linda Behavioral Medicine Center, they accept adults, adolescents, and our little guys. So Section 2, what we're going to cover here is a brief history of the LPS Act, and then a California or state legislative timeline is how the LPS Act has been sort of built out and built upon over the years. It's always important to kind of know, well, how did we get here? How did we get to a place of involuntary detention? Well, prior to 1950, the California state hospitals and asylums were not regulated. One could say poorly regulated or not regulated at all. They were performing lobotomies. There was a lack of patients' rights. There were indefinite commitments. Individuals who were severely mentally ill were placed in these facilities and essentially just left there without appropriate treatment, without their rights, without any type of process of ever getting out. And so it was not a pretty picture during that time for our severely mentally ill folks. In 1950, however, the development of certain psychiatric medications actually made community stabilization a bit more possible for some folks. So these individuals, while on this medication, they were able to stabilize and be able to function a little better out in the community with some support, but they were able to function in boarding care facilities and receive outpatient treatment. So there wasn't a need to sort of lock them in these state facilities. However, the deinstitutionalization era of the late 1950s and the reallocation of some funding That decreased the availability of these community-based resources, which ultimately resulted in, families and the local communities were unprepared and ill-equipped to care for their mentally ill loved ones. And this then led to an increase in homelessness and then an increase also in involuntary detainments without due process. So without a legal process or upholding of that individual's personal rights. And you may be thinking, well, what about the civil rights movement? That was happening during the 1960s, right? And yes, you are correct. However, the civil rights advocacy at the time was not focused on mental illness nor involuntary commitments. So we have the Lanterman-Petrus Short Act that was authored by State Assemblyman Frank Lanterman, State Senator Nicholas Petrus, and State Senator Alan Short. The LPS Act was signed into law in 1967 by then Governor Ronald Reagan, as you see in the photo there, but didn't go into effect until July 1st, 1972. So it took 5 years for the act to go into full effect. But the act states that persons with mental disorders have the same legal rights and responsibilities that are guaranteed to all other persons under federal and state constitution and laws. So essentially, individuals with mental health disorders have the same rights as everyone else. The California LPS Act set the precedent for modern mental health commitment procedures in the country. And the intent of the LPS Act was to, one, protect public safety, to safeguard individuals' rights through judicial review, provide individualized treatment, supervision, and placement services, to encourage the full use of existing agencies. And this is where that provide referrals and resources if a hold is not necessary. So you see how even in that overview, some of the initial intent is sort of expanded a bit. The intent was to protect persons with mental health disorders and developmental disabilities, to end the inappropriate, indefinite, and involuntary commitments of individuals who had mental health issues, developmental disabilities, and severe substance use disorders, just because they had those issues. This act wanted to end the inappropriate, indefinite, involuntary commitment of those folks just by those reasons alone. And then lastly, to provide prompt psychiatric evaluation and treatment for those folks who are struggling or living with serious mental health disorders and severe substance use disorders. So in regards to our legislative timeline, so again, we have the LPS Act that was signed into law in 1967, but again, didn't go into full effect until 1972, so 5 years later. But this changed how persons with individuals with mental illness were to be treated, again, in that least restrictive setting. So the next we have the Children's Civil Commitment and Mental Health Treatment Act, which was signed in 1988. And this is where, if you were ever curious, why do we do 5150/5585? Well, the Welfare and Institutions Code 5585 was written out of this treatment, the Children's Civil Commitment and Mental Health Treatment Act, because it wanted to reflect the special needs of minors with mental health disorders versus adults. So it wanted to differentiate that minors were not adults. And so 5585 applies to 17 and younger. And then in the same year, Assembly Bill 4642 or AB 4642 then changed the definition of grave disability to also reflect the needs of minors. And so this is where we get the definition that a gravely disabled minor is one who is unable to use the elements of life, even though those elements may be provided to them by another individual. And when we get to the section on legal criteria, I will cover a bit more in detail the differences between a gravely disabled adult and a gravely disabled minor, and also with the changes or more recent changes of SB 43, which again impacted how we define, or how the state rather defines grave disability. And then in 2001, we have AB 1424 or Assembly Bill 1424, which brought the information that could be included during the process of assessing for a 5150, 5585. This is where that historical course of mental health disorder, medical issues, psychiatric or medication history, all of that information could then be included in the assessment process when individuals or hold writers or determining probable cause. So that information, that historical information can be included with regards to determining and justifying or supporting probable cause to involuntary detain an individual. Then we have Senate Bill 364, which established requirements regarding the advisement, which is a verbatim statement that our hold writers must make to an individual that is being involuntarily detained. It also mandated that the assessment, evaluation, and crisis intervention take place at an LPS designated facility. It also required that offering voluntary treatment, so again, involuntary as a last resort, be offered to an individual if a hold is not necessary. So again, if we're reaching back to the original intent of the LPS Act, that least restrictive setting, this was more sort of in light of or honoring that notion of the least restrictive setting. And then also there's a statement that hold writers must make with regards to appliance and utility assistance that's associated with SB 364. Then in 2019, we have AB 2983 or Assembly Bill 2983, which states that an involuntary hold is not a requirement for transferring a patient who voluntarily seeks mental health services, and also that the receiving hospital cannot require a 5150 as a condition of accepting the patient, nor can the entity provide the transportation to a hospital. In 2020, we have, so more recently in the last 5 years, we have Assembly Bill 1968. And this is definitely, well, they're all important, but this is certainly one to pay attention to if this relates to you with regards to firearms. So the prohibition to buy or possess firearms went into effect for 2020. And essentially, what it mandates is that if an individual is placed on a 5150 for danger to self, which is DTS, or danger to others, which is DTO, state prohibition to buy or possess firearms goes into place for 5 years from the date of admission. So what's important here is that even though a hold may be written, that individual may not be admitted once they arrive to the LPS designated hospital. So that's important to know. So if the person is admitted to the hospital under 5150 for danger to self or danger to others, then the state prohibition to buy or possess firearms goes into effect from that date for 5 years. Now, if that individual is admitted more than one time within 1 year, then that state prohibition goes into effect for life. And so that's not calendar year. That's not January to December. That's 1 year from the previous admission. So February to February or June to June, right? And so again, this is admission. So I just want to keep reiterating that the prohibition to buy or possess firearms is based on whether or not the individual is admitted to the hospital. And then also, which I'll go into further detail in a minute, of what a 5250, what it involves. However, the 5250 is the extension of a 5150, and I'll explain that a little more in a second. But if an individual is written or is placed on a 5250 for danger to self or danger to others, so essentially if they are placed on an extended hold, then they will be prohibited from buying or possessing firearms under state and federal law for life. Now, the process of a firearm prohibition, what does that look like? So if an individual, again, is admitted, then the facility is required to notify the DOJ, and that person's name is then entered into the prohibition database. Once that individual has been or is preparing to discharge, they are provided the information about the prohibition and then provided information on how to go about restoring their rights if they so chose. However, again, with that lifetime prohibition, that's not likely going to be the case. So certainly something to take into consideration there. Again, now more in recent years, we have Senate Bill 929. This expanded the California Department of Healthcare Services, or DHCS, data reporting requirements and necessitates the publication of an annual report. I believe that first report was published this past month in May 2025. And so that would be the SB 929 requirement on that annual report of involuntary holds throughout the state. Assembly Bill 2275. Now, this is a significant one. Again, they're all important, but this was really, really important, significant in further standardizing the involuntary hold process. So AB 2275 specified that the 72 hours starts at the time of detainment. So this kind of standardized, when does the clock start? When does the clock start from the moment is it when they get to the hospital? So this AB 2275 answered all those questions. Just shut them all down. That the detainment, the 72-hour clock starts at the time of detainment. AB 2275 also involved the patient's rights advocate and the notification of the patient's rights, and also involved the individual that is being detained to have a right to a certification review hearing if they're ever held beyond 72 hours. Senate Bill 43, SB 43, which you may have heard a lot about, expanded the definition of grave disability to include severe substance use disorder and an inability to provide for one's personal safety or necessary medical care as reasons an individual could be placed on an involuntary hold. I should note here, and I'll reiterate later, that SB 43, the expanded definition only applies to adults, so 18 and over. The definition of a gravely disabled minor has not changed as of May 2025. This expanded definition only applies to adults. And then lastly, in 2024, also SB 1238, which then expanded the definition of a designated facility for individuals being involuntarily detained and or receiving treatment for substance use disorders. All right, so next in section 3, we will be covering an overview or doing an overview of the LPS 5150-5585 process. In this next section, we'll be doing an overview of the LPS 5150-5585 process. So first, what is a 5150-5585? Well, what is WIC 5150-5585? It is a code section in state law that allows an individual to be held involuntarily, so against, they're not volunteering for it, for up to 72 hours. So not to be held involuntarily for 72 hours, to be held involuntarily up to 72 hours, so no more than 72 hours. So under a 5150, peace officers or a certified or designated hold writer can legally detain a person and transport them or have them transported to a facility for a mental health assessment, evaluation, crisis intervention, and treatment. 5150 is not a criminal arrest, although for some individuals, if you've experienced it or were witness, it can at times feel like one, especially if law enforcement is involved, but it is not a criminal arrest. It is, however, a temporary removal of an individual's personal rights. And when I do the trainings for our certified hold writers and for our law enforcement, I continue to reiterate how important it is to keep this in mind, that what are we actually doing as hold writers? What type of power do we hold in our hands, and what kind of impact a decision to place a person on a hold, what could that look like, right? And just to keep in mind that this is a temporary removal of an individual's personal rights for the purposes of getting them assessed or getting them connected to services and receiving assessment, evaluation, crisis intervention, and or treatment. Now, this is a portion of the Welfare and Institutions Code 5150 for adults. This is not the entire part, but this is a more specific portion to what the majority of this presentation will cover. So when a person, as a result of a mental health disorder, is a danger to others, a danger to themselves, or gravely disabled, a peace officer or certified professional, designated certified professional, may, upon probable cause, take or cause to be taken into custody for a period of up to 72 hours for assessment, evaluation, and crisis intervention, or placement for evaluation and treatment in a facility designated by the county. So we understand that facility designated by the county to be an LPS facility for evaluation and treatment approved by the State Department of Healthcare Services. Now, individuals can only be involuntarily detained at a facility designated by the county or LPS designated facility. I'm going to note here that for the remainder of this training, that type of facility designated by the county or LPS designated facility, will be referred to throughout the remainder of this presentation as an LPS designated hospital. Reason being, as it stands, May 2025, San Bernardino County only has hospitals which are designated at this time. So you'll hear me use the term LPS designated hospital instead of LPS designated facility, but they are the same thing. It's just that for continuity and for clearer understanding, San Bernardino County only has hospitals, right? As of May 2025, I should say, that are designated facilities. So just for clarity. So Welfare and Institutions Code 5585, again, out of the Children's Civil Commitment and Mental Health Treatment Act, when a minor, as a result of a mental health disorder, is a danger to others, danger to self, or gravely disabled, a person designated by the county may, upon, again, probable cause, initiate a 72-hour detention for psychiatric evaluation and treatment. What is important to note here with the 5585 is that every reasonable effort must be made to involve the minor's parent in the crisis evaluation process. So if the minor requires hospitalization, so if it has been established that the minor is either a danger to themselves, a danger to others, or gravely disabled, and so we've established that hospitalization is necessary, the parent must be allowed to admit their minor voluntarily to the hospital, unless the parent is not able, is not capable, or is unwilling. Because again, we are talking about safety. If it's already been established that the minor requires hospitalization, that their safety is in question. If the parent is not able to take them to the hospital, is not capable of taking them to the hospital, or is unwilling to take them to the hospital, then the hold writer or the peace officer may initiate the 5585 involuntary hold. They are legally able to do that. So we've mentioned in both of those probable cause. So what is probable cause with regards to involuntary holds? Probable cause is the legal standard needed to detain a person under Welfare and Institution Code 5150. It is defined through the courts as a state of facts that will lead a person of ordinary care and prudence to believe or to entertain a strong suspicion that the person being detained is mentally disordered and is a danger to themselves, to others, or is gravely disabled. Determining probable cause is not a clinical decision. It is a legal one. So again, this entire process, although it involves a great deal of mental and behavioral health elements, this process is a legal process. So determining probable cause is not a clinical assessment or a clinical evaluation. It is a legal decision. Probable cause, therefore, does not require a diagnosis, but does require evidence of impairment in observable functioning. And I will use that term frequently throughout this presentation because the evidence of impairment in observable functioning is what is used to support probable cause and then justify taking a person's individual's personal rights away, even temporarily. So we need to be able, the diagnosis does not justify taking a person's rights. Therefore, probable cause doesn't require a diagnosis. It may be important information, so that additional like historical course of mental health or medical health. However, writing an involuntary hold does not require a diagnosis. It does require what is the evidence of impairment? What is the evidence that this person is not functioning in a way that is safe for them, or is they're in danger or in potential harm, harming themselves, harming others, or gravely disabled. And then we move into inappropriate reasons for an involuntary hold. And I'm very, very passionate about this particular slide because it is critically important for individuals to understand that there may be a need for intervention, but that intervention may not necessarily be an involuntary hold. And so reasons for or inappropriate reasons for an involuntary hold. an individual having a mental illness, an intellectual or developmental disability. Just because they have these, one of or all of these, does not mean we're going to place them on an involuntary hold. If an individual is unhoused or has a substance use disorder, just for those reasons alone is not a reason to take away a person's individual personal rights. Individuals diagnosed with dementia or a neurocognitive disorder, just because they have these diagnoses is not a reason to place them on an involuntary hold. And then lastly, misbehavior, misconduct, delinquency, non-compliance, defiance, disobedience, or essentially being a teenager, or a person just, not following the rules. Those are not reasons to place a person on an involuntary hold. Probable cause is not supported and legal criteria is not justified by these reasons alone. And you'll hear me say that several times throughout this presentation. And when we get to some of the detainment considerations, hopefully you'll have a better, clear understanding as to why we emphasize that this is not justifiable by these reasons alone, that the involuntary hold requires several pieces of the puzzle. So again, some considerations with regards to involuntary hold. To keep in mind, first and foremost, the purpose or the intent, the goal is to link the individual to the level of care that they need, not to penalize or criminalize them for having a need. We want to consider the potential impact, specifically with regards to the firearms prohibition, if the individual is admitted and they're in law enforcement or security or military, or on minors or young adults who might want to enter these career fields in the future. Those prohibitions don't go away. So now we've either, a person, if an inappropriate hold, for instance, is written and it's a law enforcement officer, now that person can no longer work as a law enforcement officer. Now they've lost their career. Or maybe a young person now will never have the opportunity to be in the military or to be a police officer because of that hold. So we want to make sure that we not only understand the gravity that's associated with writing the hold. Now, please, I don't want to encourage anyone to be hesitant about writing a hold. So I should say, or considering whether you need to make a phone call to have a person assessed. I just want to reiterate the importance of offering, as this third bullet point states, voluntary treatment. So again, just because a person that intervention is required, it doesn't automatically equate to, well, we have to place or we have to, get this person placed on a 5150. Offering and encouraging voluntary treatment is a legal requirement. So this is where that voluntary treatment comes into play. If the person is in crisis and they're willing to seek voluntary treatment and they do that, the 5150 goes away, the prohibition goes away, any of the negative outcomes of having an involuntary hold, all of that goes away. So this is the key point here, is that although we may have individuals who might be significantly impacted by, for instance, the firearm prohibition, this is where the voluntary treatment, offering the voluntary treatment, encouraging the voluntary treatment really comes into sharp focus. And a couple of other points about involuntary holds. The LPS Act cannot be used to authorize physical health care. So the 5150, 5585 does not authorize involuntary medication or medical treatment. An involuntary patient, so a person placed on an involuntary hold, still maintain the right to refuse medication and or medical treatment unless if they are found to not have the capacity to consent or refuse treatment, or the situation is deemed an emergency. But it's important to know that even if an individual is placed on an involuntary hold, they still maintain their rights. And that's, again, in the spirit of the LPS Act, and not treating a person as if they don't have rights and they don't have a say and they cannot consent. If they are found to not have the capacity or the situation is deemed an emergency, then, and other than those reasons, the LPS Act cannot be used to authorize the physical health care. So a question here, what happens after the 72 hours of the 5150 hold? What happens after 72 hours is up? So the clock is run out. After the hold ends, the individual can either be discharged from the 5150 hold and the hospital, can be admitted as a voluntary patient for continued treatment, or they will continue to be held involuntarily under a different type of hold. So that's what I mentioned earlier about the extension. These are the different holds. And I will go through them individually. So we've already established the 5150, 5585 is the initial hold. So that means that that individual has been found to be a danger to themselves, a danger to others, or gravely disabled. They could be taken into custody for up to 72 hours at a LPS facility, or with San Bernardino County, an LPS designated hospital. Now, the extension, the next code, the extension of a 5150 is a 5250. So following a 72-hour hold, the person may be involuntarily detained for an additional 14 days of intensive treatment if found to still be, because of a mental health disorder, a threat to themselves, a threat to others, or gravely disabled. So in other words, if the 72 hours has run out and the individual is still meeting legal criteria for either DTO, DTS, or GD, then they can be held for an addition, legally be held involuntarily for an additional 14 days. Following the 5250, then the extensions sort of become more specific to the legal criteria. So as you'll see here with 5260, is specific to danger to self. So if the person following that initial extension, so following the 5250, following the 14 days, under the 5260, if the person is still found to be a danger to self and they are unwilling or unable to accept voluntary treatment, then they may be detained for an additional 14 days. So if a person is a danger to themselves and they be placed on the 5150, if after the 72 hours is up, and they are still a danger to themselves, they can be placed on a 14-day extension under the 5250. Once those 14 days are up and they are still a danger to themselves, then they can be, and they're unwilling or unable to accept voluntary treatment, which I should point out here, that is always the case. Then they can be held for an additional 14 days involuntarily. And then the following codes, again, are specific to the different criteria. So Welfare and Institutions Code, or WIC 5270, if the person is found to be gravely disabled and they are unwilling or unable to accept voluntary treatment following that initial extension, then they may be detained for an additional hold up to 30 days following that initial 14-day extension. And then with the 5300, if the person is deemed imminently dangerous to others following, again, that initial extension, the person may be detained for an additional hold not to exceed 180 days. With regard to conservatorship, we have WIC 5352, which is the temporary conservatorship, and then WIC 5350, which is the full conservatorship. So temporary conservatorship is up to 30 days and the full is 1 year. The LPS Act does provide for conservatorship of the individual, the estate, or both, for a person who is gravely disabled because of a mental health disorder, to provide individualized treatment, supervision, and appropriate placement. And just a quick point here with regards to individuals on conservatorship. LPS conservatorship has the authority, to have a conservatee, taken into custody and transported for evaluation when provided evidence of current conservatorship paperwork. So when the conservatorship paperwork is provided, the evidence is presented that this individual, the person being detained, is under conservatorship, then law enforcement or ambulance providers, they can transport an LPS conservatee without a 5150. It is not illegal to initiate a 5150 on an LPS conservatee. However, it is not required for transport. And that was the end of section 3. Now we will go into section 4, which is the legal criteria for involuntary detention under danger to self, danger to others, or gravely disabled. Okay, so in this next section, section 4, we will be covering legal criteria for involuntary detention. First up is danger to self, or DTS. So danger to self is a deliberate intention to injure oneself, such as an intentional overdose or disregard to personal safety to a point where injury is imminent. The danger, real or perceived, must be present, immediate, substantial, physical, and demonstrable. The individual has indicated their intent by words or actions or both, and that they have indicated a specific plans or means by which they will carry out their intention, and those plans or means are available or within their ability to carry out. Also, the individual refuses to accept or is unwilling or unable to obtain psychiatric evaluation and treatment. So this is the legal criteria under danger to self for an involuntary detainment. And something to note here, evidence of being a danger to self does not have to be personally observed by the hold writer. This may be reported by a third party, a reliable witness, or what we would call clinically is a collateral information. So that information is shared by maybe a parent or some other individual other than the person being detained. But again, that this is a piece of it, piece of the whole picture. So some critical questions to consider. I should state here, San Bernardino County does not authorize or is not encouraging individuals to use these questions as a means to evaluate or to assess an individual that they are concerned about. Again, this presentation is being presented for educational and informational purposes. So the county is not presenting these questions or this list of questions rather as a means of assessment or a tool to be used for evaluation. But the first question, does the individual intend to end their life? So there is an intention there. When did they consider it and how would they go about ending their life? Is there identified method available to them? So the plan that they've established, is it available to them, or is it within their capacity to obtain that method? What steps has the individual taken to obtain the lethal method? So what have they done to try to get a hold of their method that they've identified in their plan? And then this one, it is an important one to note because sometimes it can be missed. If they chose what you and I, or what we know to be a non-lethal method, so a method that would not result in loss of life, did the individual believe that the method, the non-lethal method, was in fact lethal? So that they believe that the method they've identified would end or would result in loss of life. Because again, we're looking at an individual as a result of mental health disorder. So their belief may be impacted by their mental health, and they believe that the method that they chose would actually result in loss of life. And then lastly, has the individual taken action to end their life in the past? As a clinician, we know that, past history of attempts to complete suicide or different ideations, like that historical information, that course is important in terms of assessment and diagnosis. So when determining or assessing for dangerousness or seriousness, has the current method that's been identified, has it been refined to be lethal? So has the individual changed their method, or have they refined it? Have they, I don't like to describe it this way, but have they practiced, to ensure that the method they've identified will indeed result in loss of life? And again, this is not an assessment. You can Google this. There's questions are out there, but this isn't something that the county is presenting as a suggested tool or assessment method. And again, here, this is also another tool. You can Google this. It's called the Sad Person's Scale. Again, not to be the position of the county is not to present this as a method or a tool or an assessment to be used to for it by anyone, but is being presented in this presentation as a resource or a tool that could be used to determine or maybe evaluate. So sex, and what we're looking at is primary risk factors for suicide. So the individual's sex, the individual's age, whether they are diagnosed or undiagnosed with depression, if there's been suicide attempts in the past, any ethanol or alcohol abuse, any rational thinking loss. Is there any presence of psychosis, this break with reality? Has there been a support system loss, or is there a support system in existence? This person, do they have connections with friends or community of any kind? Is there an organized plan to complete suicide? Is there a loss of a significant other or non-existence? So divorce, widowed, single, and then lastly, sickness. So is there physical illness, specifically like chronic illness, where a person may, as a result of their illness and they're trying to manage their symptoms, their motivation or their desire to go on living has been impacted. So these are things to take into consideration when determining danger to self. Next is going to be danger to others. So this is DTO, danger to others. So there's verbal or physical action that would indicate that the individual is intent upon causing harm to others or disregarding the safety of others. This intent has been indicated by words or actions, and then those words or actions are specific, or those intentions are specific to an individual or individuals that they wish to do harm to. So there's an identified target, so to speak, or an individual that they are focusing on, or a group that they are focusing on. The individual identifies the means by which they would carry out their plan, and then those means are within the ability of the individual, or they have access to obtain those means in order to carry out their intentions. And the individual's acts or words regarding their intent are based on or caused by their mental state. And then lastly, again, the individual refuses to accept or is unwilling to obtain, unwilling or unable, sorry, to obtain an evaluation and treatment. So then this would be the legal criteria under danger to others. And just to kind of point out a couple of things here with regards to the identified individual or intended victim. So if a person says, for instance, I'm going to kill, John Doe, or I'm going to destroy Jane Doe's home, or I'm thinking about going and setting fire to this church or this school, and that there's like this specific or semi-specific, but there's intention, there's plan, and it's present, right? And the person has the capacity to carry that out, and they refuse to accept, unwilling or unable to obtain an evaluation for treatment. That then would meet the legal criteria for danger to others. Next, we have gravely disabled. So on the left, we have the definition of a gravely disabled minor. Gravely disabled minor is one who, as a result of a mental health disorder, is unable to utilize the elements of life which are essential to health, safety, and development, including food, clothing, and shelter, even though those things are provided to the minor by others. So in other words, because of a mental health disorder, if a minor refuses to eat, to clothe themselves, or receive shelter, if they, these things are provided to them and they refuse or they're unable to utilize these elements in order to help to maintain good health and safety, then that would qualify under the gravely disabled minor criteria. Now, a gravely disabled adult, as of the date of this recording, which is May 2025, a condition in which a person, as a result of a mental health disorder, a severe substance use disorder, or co-occurring mental health disorder and severe substance use disorder, is unable to provide for their basic personal needs for food, clothing, shelter, personal safety, or necessary medical care. So you will see the difference between unable to utilize and unable to provide. And specifically, what differentiates the minor from the adult is we do not expect minors to provide for their own food, clothing, shelter, personal safety, or necessary medical care. They are minors. So that is the specific differentiation between a gravely disabled minor and a gravely disabled adult. Now, for SB 43, Senate Bill 43, this was passed again, as I stated earlier, in 2024. However, counties throughout the state were given the flexibility to implement by 2026. San Bernardino County implemented SB 43 on April 1st, 2025. And just to ask for comparison, so there's understanding of what the differences are, the former definition of grave disability was a condition in which a person, as a result of a mental health disorder, is unable to provide for their basic personal needs for food, clothing, or shelter. As of April 1st, for our county 2025, the new definition for grave disability is a condition in which an adult, as a result of a mental health disorder, a severe substance use disorder, or co-occurring, mental health disorder and severe substance use disorder, is unable to provide for their basic personal needs for food, clothing, shelter, personal safety, or necessary medical care. And again, to date, as of May 2025, SB 43 does not apply to minors. So this only impacts our adults 18 and over. So with the expanded definition, there's a couple of new terms. So personal safety, necessary medical care, and severe substance use disorder. So let's break those down so we know what does that mean, right? So personal safety, the ability of one to survive safely in the community without involuntary detention or treatment. So courts have ruled if an individual is able to survive safely in the community, even with the help of a third party, if they're able to do that on their own, they are not considered gravely disabled. So essentially, even if a person is existing in the community under means that are not acceptable by, by common society standards, that doesn't mean that they're gravely disabled because they're living on the street. Granted, maybe intervention might be necessary or some resources can be provided, but just being a person, an unhoused person, for example, just living in conditions that are not deemed, where society thinks that they should be, that does not mean that a person is gravely disabled. Second, necessary medical care. So care that a licensed healthcare practitioner, while operating within their scope of practice, determines to be necessary to prevent serious deterioration of an existing physical medical condition, which, if left untreated, is likely to result in serious bodily injury. And if you're wondering, well, what does that mean? I will go over some examples to sort of kind of illustrate what this could look like. It's not an exhaustive list, but just to kind of give some examples of like, okay, well, what might that be? Or what are the circumstances where that would be the case? And then lastly, severe substance use disorder. So what is meant? How is severe substance? So how is severe defined with regards to a substance use disorder? So it's a diagnosis substance-related disorder that meets the diagnostic criteria of severe. Severe meaning 6 or more symptoms as defined in the most current version of the Diagnostic and Statistical Manual of mental health disorders. Oh my gosh, I didn't. That's a typo there. But Diagnostic and Statistical Manual of Mental Health Disorders. So that's known in the clinical world as the DSM. It is what we use to diagnose an individual. So again, I want to point out that diagnosis is not required in order to determine if a person meets criteria, but this is entered here for purposes of understanding. So that one we'll understand what is meant by the term severe. How do we determine a severe from a, moderate, right? So this is just specifically mentioning diagnosis with regards to how severe is determined. So, so in other words, so when an individual is, or a hold writer, I should say, is evaluating an individual and trying to determine if they meet the legal criteria of grave disability, that evaluation should consider that individual's ability to utilize the means available. Are they able to provide for their basic personal needs regarding food, clothing, shelter, personal safety, or necessary medical care? Those are the 5 elements, right? That's it. That is the nuts and bolts of grave disability. Food, clothing, shelter, personal safety, or necessary medical care. That is the nuts and bolts. That is the nucleus of determining grave disability. The evaluation should also consider if the individual is able to self-advocate. So are they able to receive assistance to meet those personal needs? So one, do they know what food is, why they need it? Secondly, do they know how to get it, how to access it? Do they know why food, clothing and shelter are important, why they need it? Are they able to access and meet those needs on their own? Or are they able to access resources on their own to receive assistance in meeting those personal needs? And then lastly, again, just to reiterate, Are they able to survive safely? The law does not require an individual to be able to thrive according to society's standards. The question is, are they able to survive safely without involuntary detention, possibly with the help of family, friends, or organizations or others who are both willing and able to help provide for the person's basic personal needs. So essentially, homelessness or being unhoused or just using substances alone does not justify an involuntary hold. There are several elements that have to be articulated and presented as that, as the next statement illustrates, evidence of impairment in observable functioning. Person initiating the detainment, the hold rider, needs to be able to describe the behaviors, the conditions, the symptoms that would justify a 5150 hold for grave disability. They have to be able to provide the evidence, give examples. What is the person doing? What are the conditions? What is the person experiencing that meets the criteria or justifies removing their personal rights because for grave disability in order to get them connected to services? So these are some examples. Again, this list is not exhaustive. There are several other examples of what these are, but this is just more for understanding. So an example of meeting grave disability, with regards to shelter, if the individual is unable or unwilling to seek shelter or unwilling or unable to utilize shelter when it's provided. If they're unable to provide a reasonable plan for shelter, then they would be likely to meet the criteria under shelter. Same for food and clothing. If they're unable or unwilling to obtain or even eat food, even when it's provided, or if they have irrational beliefs about food. So for instance, a delusion that if they eat the food, that it's poisoned, or they're going to turn into a monster or something like that, that they have this irrational belief. And this kind of reaches back to that presentation of psychosis and that break from reality. Under clothing, if the individual refuses to wear clothing and or is unwilling to clothe themselves, even if clothing is provided, or if the individual wears clothing that is severely damaged or filthy or is unsuitable for the weather, that would present a health risk. So they're wearing a bikini in, below zero, or they're wearing several layers of coats in 100+ weather. These would be some of the examples of what this could look like. Again, this is not an exhaustive list. This is what these examples could look like. With regards to the expanded definition under necessary medical care, if the individual is unable to utilize medical care when it's needed, they're in severe physical pain and there's medical care that they can access and is available to them, but they are unable to utilize it. If there are wound care and infections present that are likely to lead to loss of limb or even life, and they go untreated because the individual is not able to utilize that medical care. If untreated or life-threatening threatening comorbidities are present, like HIV, diabetes, cancer, liver or kidney disease, and these conditions are not being treated, this could then result in loss of life. With regards to personal safety, for example, multiple near fatal overdoses requiring inpatient hospitalization. If that is the case, that could be meeting the criteria, or I'm sorry, probable cause for personal safety. I should note here, though, Narcan reversals or naloxone reversals alone would not meet this criteria. So again, maybe a person has an accidental overdose that doesn't justify a hold for grave disability. So we can't say just having having the Narcan reversal, just like needing that reversal would meet criteria. It would not. We're talking about multiple near fatal overdoses requiring inpatient hospitalization. So there's a distinction there. And then an individual that's incapable of defending themselves and incapable of keeping themselves safe in the community because of a mental health disorder or severe substance use disorder. They're incapable of defending themselves against ongoing victimization, assault, abuse, exploitation, etc. Yes, etc. So again, when we are determining probable cause would not be met of any of those examples that I just gave on their own. Probable cause was met by the totality of the person's situation. So again, just being unhoused by itself is not sufficient to constitute grave disability. So each one of these elements, that those five things like food, clothing, shelter, personal safety, necessary medical care, each element is a piece of the puzzle, but it's not the entire puzzle itself. There's still, you have to be able to present all of these elements as evidence of impairment in observable functioning. In addition to that, subjective and objective observations from third party or collateral or even self-reporting accounts of functioning impairments are to be considered. So if the person is sharing information about, areas of their life that they're not functioning at a healthy level, and I should also note here, even though insufficient for probable cause alone, that collateral information, so that information that has been acquired via a third party, like a neighbor or a relative, it is to be considered, but it supports probable cause. It does not define it. Okay. So again, this last statement, observable function contributes to probable cause, but it does not constitute probable cause. In other words, that observable function supports probable cause, but it is not, the observable function is not the probable cause in and of itself. I know it sounds a little bit confusing, but it's like, in other words, you have to put all of the pieces together in order to be able to legally detain a person under grave disability. And hopefully this will help. This is an infographic that will kind of drive the point home of what this process should look like in determining if a person meets criteria for gravely disabled. So again, the first question that a hold writer would ask themselves is, can the individual provide for their basic personal needs for food, clothing, shelter, personal safety, and or necessary medical care? If the answer is yes, they can provide for those needs, then they are not gravely disabled. We're not going to write an involuntary hold. We're not going to temporarily remove their personal rights because they are able to do this. Now, that may still mean maybe their intervention might be necessary. Maybe they don't have the resources. Maybe they just need to be able to be connected to the programs where they can get some support. So we don't want to remove their rights to get them connected to services when we don't need to. If they're able to provide for their basic personal needs, and maybe we just need to be the bridge to connect them, then that's where you would provide, or the hold writer would provide resources, offer assistance, and of course, encourage voluntary services. Because again, there may be something going on where that person could benefit from resources or services, but we're, with regards to the question of, are we authorized, or is legal criteria met in order to place someone in involuntary hold? If they can provide for their basic personal needs, it is not. Okay. So with that same question, if they cannot provide for their basic personal needs for food, clothing, shelter, personal safety, and or necessary medical care, is the reason they cannot provide for those basic personal needs due to a mental health disorder, a severe substance use disorder, or both? If the answer is no, they are not gravely disabled. So backing it up, they cannot provide for their own basic personal needs, but the reason is not due to a mental health disorder or severe substance use disorder. They are not gravely disabled, but again, if an intervention might, be necessary, resources, assistance, encouraging voluntary services will be the direction that the hold writer would go in. So you may be asking, well, in what situation would a person not be able to provide for their personal needs, but it not be due to a mental health disorder or severe substance use disorder? Well, if a person with dementia or developmental disability, they may not be able to provide for their own personal needs. They need assistance. They can't do it on their own, but they are able to, but the reasoning is not due to any of these things, that it's due to developmental issue or some other issue. And they, may be requiring assistance, but we are not going to place them on an involuntary hold for those reasons alone. Now, if the answer is no, they cannot provide for their basic personal needs for food, clothing, shelter, personal safety, and or necessary medical care, and the reason is due to a mental health disorder, a severe substance use disorder, or both, then we would write the 51, or the hold writer would write the 5150 hold, because that person then would meet criteria for grave disability. And then when the hold writer does initiate that hold, they then need to describe the impairment in observable functioning with regards to those 5 areas. So the person refusing to eat, refusing to clothe themselves, refusing to access shelter, they can't keep themselves safe, or they have a life-threatening illness that they are not receiving any treatment for. So this hopefully is helpful. I'm a visual learner, so this is very helpful for me to kind of put it in perspective and sort of break down the steps to better understand what gravely disabled looks like in result to the new as a result, sorry, of the new definition with our state. So in the next section, we will be covering some considerations with regards to involuntary detainment. All right, in the next section, section 5, we are going to be covering some considerations with regards to involuntary detainment. So first, and hold writer, for the certified hold writers, in order to initiate an involuntary hold, the individual must meet all 3 of the following criteria. They must be experiencing a behavioral health crisis. They must be unwilling or unable to accept voluntary services, because again, that is a legal requirement to offer that. And one or more of the following is true. They are either danger to themselves, a danger to others, if they are an adult, gravely disabled due to a mental health disorder, a severe substance use disorder, or both a mental health and a severe substance use disorder, or a gravely disabled minor, which is due to a mental health disorder. Oh, I'm sorry, gravely disabled due to a mental health disorder. It's important to understand here that the basis for holding a person in a designated LPS facility, it is not a medical model. This is a legal model. There are legalities throughout this entire process, which is why there's a need to be certified, or rather a need to be eligible and then to be certified, and then also to recertify, because of the legalities associated with removing a person's individual rights. And then again, in the spirit of the LPS Act, the premise of involuntary detention is for the purposes of getting an individual linked to the services that they need, but also upholding and maintaining that individual's rights along the way. So offering that voluntary service. The law and courts have consistently held that personal freedom is the most important right that we have. So the court is looking for behaviors that lead the hold writer or the initiator to believe that a person is a danger to self, danger to others, or gravely disabled. So in other words, the courts are looking for that evidence in impairment and observable functioning. In other words, simply believing that someone is very sick or is in need of psychiatric intervention does not meet the legal criteria to involuntary detain them, or rather does not meet the legal criteria to remove their personal rights. There is no law, quite frankly, against being psychotic, against bizarre behavior, or even against acting inappropriately. It is not illegal. There's no law against that. Obviously, if a person is breaking the law, then that's different. But just by way of experiencing psychosis or behaving oddly, that does not justify any legal criteria to involuntary detain someone. So the burden of proof actually falls on the treatment facility, on the LPS facility, to show that that person does meet the legal criteria for involuntary detention. But the hold writer initiating the hold has to be able to articulate that, or to indicate that on the application, and then have the person, or facilitate the person being transported to the LPS facility to determine whether they will be admitted under that criteria. Some requirements with regards to our hold writers our hold writers and those individuals out in the community, or you as the viewer, should be aware of. So when a person is being involuntarily detained, that person must be provided with proper advisement orally or in a language or modality that's accessible to them. And it's a particular statement that must be read verbatim to inform them that they are not under criminal arrest, and then provided important information such as the name, position, and agency of the person who is initiating custody. So of the evaluator or the hold writer, told the name of the facility where they're going to be taken for evaluation. So they are expected, they're legally, they must be told where they're going. And then again, told that they're not under criminal arrest, but they are being detained for evaluation by a mental health professional. And again, just to reiterate here that this process can be very scary. It could potentially be traumatizing. It's not a fun process. I mean, if a person is experiencing a behavioral health crisis, if they're experiencing, say for instance, psychosis for the first time, or they're experiencing, just any significant crisis with regards to their mental health, that could be very disturbing and very, traumatic and very scary. So it's important for all individuals involved to understand that and to approach it with that, that sense of perspective. Additionally, the individual being detained, if they're being detained at their home, they also must be told that they can bring a few approved personal items with them, and the person initiating the hold will be the approver, so to speak. They are to be allowed to make a phone call and or they'll leave a note to let friends and family know where they are. We understand again that although the hold can be up to 72 hours, we don't know if they're going to, the individual, when I say we, I mean the hold writer, we don't know if they're going to be held for the full 72 hours, if they're going to be held for 24 hours, if they're going to be held, beyond that on that 5250 extension. So there's really no way to know, at least at the initial detention point, how long that person is going to be involuntarily held. So it's important. So I would, just put yourself in that person's shoes. I would want to make sure that my family knew where I was, and why I wasn't where they expected me to be. Also, the person initiating the hold has to ask the individual if they need any assistance turning off any appliance or water. So for instance, if the sprinklers are on in the backyard, or, if the shower's running or the bathtub's running, or if there's something cooking on the stove. So obviously for safety reasons, to ensure that those things are taken care of. With regards to personal property, so the law actually includes children and pets under this term personal property. I just um, kind of struggle with that a little bit. Like I want to differentiate children and pets, but in other words, in the context, personal property. So a person initiating a 5150, 5585 involuntary detainment, so a hold writer, shall take reasonable precautions to preserve and safeguard the client's children, pets, and property in the possession of or on the premises occupied for the individual. This is client here, but the individual being detained. So if a reasonable relative, guardian, conservator is available, children and or pets may be left in their care. So again, I remember in a previous training, our law enforcement, one of the leadership said, no, we won't take reasonable precautions with kids. We're going to ensure their safety, right? And I would, assume obviously we wouldn't, just leave children to their own devices if the hold writer is detaining an adult or parent of the child. So we would want to take every step to ensure that the children and of course the pets, because they're our fur babies, are appropriately taken care of and left in safety. And so this also means that some other not so comfortable considerations might need to be put into play. The hold writer might need to involve child protective services if a guardian or relative is not available. We're obviously not just going to leave, like I said, children to fend for themselves. With regards to pets, the hold writer might want or need to collaborate with a local shelter or a community organization. I know there's like temporary fosters. There's different programs available to ensure the safety of the pet. And then also might even need to consider some storage options for property or some personal items or defects of the individual. With regards to transportation, once a person is detained under the WIC 5150, 5585, that person should be taken to an LPS designated hospital for evaluation within a reasonable time. So, as soon as possible, right? But there's some considerations there. So medical clearance might be required due to certain conditions, or even due to some of maybe the designated hospital's requirements. Since medical does trump psychiatric, we would want to ensure, or the hold writer would want to facilitate medical clearance taking place before the psychiatric need is met. And, it is, recommended actually to contact or for the hold writer to contact the LPS designated hospital to determine if medical clearance is even required. And just for reference, we have the 5 LPS hospitals listed there again for your reference. So with regards to medical clearance, AB 2275 or Assembly Bill 2275 actually clarifies, just to reiterate, clarifies that the 72-hour hold begins at the time the person is first detained, that the 72-hour clock starts ticking at the time of detainment. So if an individual is brought or is taken to a non-LPS designated hospital, so if they're taken to the emergency department and the emergency room, that at a hospital that's not one of those 5, if they're taken there for medical clearance and there isn't a 5150 certified hold writer available, then that hospital, or rather that ED, that emergency department, has the option to issue what is an HSC 1799.111 until the detained individual is medically cleared. And you're like, well, what is that? What's a 1799? Well, a 1799, again, it only applies in those non-LPS designated hospitals. So ED that's not one of those 5 designated hospitals. This is essentially meant to be used as a tool for emergency departments. It's meant to be, a safety gap measure when there's probable cause that the person being brought in, there's a reason, there's probable cause that that person is either a danger to themselves, a danger to others, or gravely disabled, and there's no certified hold writer available. Or the ED would like to assess the individual a little bit more. Let's say they came in like, severely under the influence, so they don't know if it's, are they in there, maybe they're making statements of wanting to end their life or complete suicide. So in that instance, maybe the ED might want to, allow the person to dry out or sober up a little bit to determine if they're going to move forward with getting that person placed on the 5150 hold, because again, we want to always assess whether the hold is necessary, whether it's appropriate. So in that case, being able to involuntary detain a person at a facility that's not designated, that facility is able to use the 1799 as a way to detain that person to be able to determine if a hold is necessary. So essentially the 1799 allows a licensed professional staff at a non-LPS designated hospital, so at a hospital that's not a designated hospital, to detain a person legally. So to legally detain a person for up to 24 hours to assess them and to determine if a 5150 hold is necessary. So essentially what this is that it provides immunity to the hospital from liability for false imprisonment, because again, they are involuntary detaining a person because they may need to write a 5150, but they're not quite sure yet. So this allows for the hospital or the ED to be protected from liability for false imprisonment. And then it also allows that if that person, let's say for instance, does then meet criteria and that 5150 is written, however much time that that person was detained at that ED, that's counted in that 72-hour clock. And that's you can look that up if you have more questions about how the 1799 works. So next, we're going to talk about the application for detainment. So for purposes of sort of excuse me, for the purposes of ensuring that folks who are not certified or eligible are not out in our county writing holds, I will not be covering the application in its entirety. I did include this slide here just so that you are, as if you were able to, so you know what the application looks like. So this is what it looks like. It's a two-sided document when it's a hard copy, and then if it's electronic, it's on a fillable PDF. But the DBH 5150, 5585 application for up to 72-hour assessment, evaluation, and crisis intervention or placement for evaluation and treatment form, or for short, the application for detainment. And this is written in reference to the DHCS 1801. That is the state form. That form was updated in 2024. The only difference between the county's form, the CLP 050, and the state form DHCS 1801. There's just two differences from the document, and that is the director notification on the second page, and then the information with regard to badge number and control number. Other than that, the documents are the same. But this particular document was the department's San Bernardino County's document, I should say, was revised and renumbered in July 2020 and then revised again most recently in December 2024 to include the expanded definition of gravely disabled. So that is what the application looks like. But again, I won't be going over the elements of the application or how to complete it in this video because only our certified hold writers are trained on how to complete the application. But it is important to point out here the application for detainment and what it is. So again, the hold, the application itself, like that process is not a guarantee of admission to an LPS designated hospital. The application is exactly that. It is an application for involuntary admission until the LPS designated hospital can assess the individual to determine if the detention is appropriate. So a hold writer initiates the hold process and then writes the hold, gets the person to the designated hospital, and then once at the hospital, that facility will then determine if the individual will be admitted. So it's important to understand the difference there, that just because the application is written and the hold is initiated, that does not necessarily guarantee that that person is going to be admitted. So this is where someone could be taken in on a hold and then be discharged within less than 24 hours. Some people are like, well, that doesn't make any sense. Well, that means that that person was the hold was initiated, but then once they arrived to the designated hospital, it was determined that the involuntary detention was not appropriate. Secondly, the application is a legal document because, again, this is a legal process. It can assist the hold writer if a legal suit is filed. And it's important to note here, false statements by the certified hold writer and or a third party can result in civil liability. So that's an important thing to note, that any information included on an application that was provided by a third party, if it is false, and especially if the information provided by a third party, so say a relative or a parent or a neighbor or the hold writer, if the information included on the application results in that person being detained, that person providing that information can be held civilly liable to the person who was detained. So not only do we want to make sure that we are quoting, for hold writers, getting the accurate information or as accurate as we can under the circumstances, but we also inform the individuals providing the information that they, need to tell the truth, and we need factual information. And then again, because it is a legal document, it must be legible, complete, and preferably written in black ink if it's handwritten, because the document may be copied. And then lastly, it is a vital treatment related document. This document can be used to inform the staff. So once the hold writer has initiated the hold, that might be, the end of their involvement in the process. So ensuring that the hold writer completes the application completely and fully and really articulate what the impairments are, that's going to then assist the inpatient staff and the treatment staff in determining what's the best course of action. Excuse me. So again, just to reiterate here, although a hold may be initiated, that does not necessarily mean that the person will be admitted. And this is something to keep in mind with regards, again, to that firearms prohibition and the offering of voluntary services. Even if the person is initially, if the hold is placed and the involuntary hold is initiated, even once the person arrives to the hospital, they're still they're still going to be offered voluntary treatment, and they're actually offered voluntary treatment at several steps throughout the process, which if you watch the patient's rights portion of this presentation, you will give a little bit more detailed information about what that looks like. All right, so next we're going to be covering some additional considerations, some additional topics or things to consider with regards to the involuntary hold process.
Weaver. I'm with the Office of Patients' Rights, and I'm going to present the Patients' Rights section of our training. First, I just want to share a brief overview of what the Office of Patients' Rights does in each county and in San Bernardino as well. We investigate patient right complaints that come from patients, most often from the inpatient crisis facilities. We do monitor all mental health facilities and programs for compliance with California law and federal laws. We provide education and training to providers regarding mental health law and how to apply the laws to treatment program. We advocate and represent clients in mental health hearings through the due process that patients have when they are involuntarily held in a treatment program. We gather and report information to State Patients' Rights Office as well as disability rights. This includes denial of rights, facilities that have ECT programs, and any seclusion and restraint. We also act as a mediator and a liaison for the patient with the treatment providers. We've divided the rights into two main groups. Basically, there are rights that can be denied with good cause, and then there are rights that cannot be denied for any reason. And we'll touch on a couple of those. The rights that cannot be denied usually have to do with constitutional rights and federal law. They also have some treatment rights that cannot be denied for any reason. Although there are some rights that pertain to inpatient or treatment that can be denied with good cause. In the bottom there, we wanted to share that each time there's a patient that is admitted to an involuntarily or voluntarily to an inpatient program, they receive a state patients' rights handbook that really outlines what to expect and what their rights are in that facility. And speaking of good cause, I wanted to note that um, you can only deny one of the rights, patient's rights, is if you have evidence to believe that the right would actually harm the patient or harm others, or that they would be causing serious damage to the facility, and that there's no lesser means of preventing that harm or damage. We always want to do denial of rights at the very last, as a last resort. You cannot deny a right to a patient for punishment or for staff convenience. Rights are not privileges to be earned, and they can't be waived as a treatment modality or a part of their treatment plan. As far as undeniable rights, uh, we group those together as far as looking at treatment services. Everyone has a right to be receiving services that allows them to function independently and to provide them in a way that are least restrictive of a person's liberty of that individual. Don't want to take their ability to have their freedoms if at all necessary. Everyone has a right to receive mental health services without discrimination for any of these categories or other, and also to receive treatment that's free from harm. That includes any unnecessary or excessive physical restraint or isolation, seclusion, medication abuse, or any other types of abuses. Um, the medication, when you provide emergency medication, it cannot be used for staff convenience or for a substitute of a program modality or intervention. In Senate Bill 364, it changed some of the information that needs to be going on to the patient advisement form when they are brought to inpatient facility for treatment. Basically, they need to now make sure that the local patients' rights office information is there so that patients can contact us easily. We've listed a few categories of information that need to be on the advisement, including the name of the person who's detained, the name of the peace officer or mental health professional who brought them to the facility, the date the advisement was completed, and to make sure if the advisement was not able to be completed, that that good cause was described there on the form itself. For involuntary admission, um, when a person comes, even if you are placing them on a 5150 hold and you're transporting them to the facility's responsibility is to provide an evaluation while they're there to determine whether or not they're able to accept them on a voluntary basis first. That's critically important, and that will come up a lot in training that you take. We really want to provide that ability, if at all possible, not to have to place them on an involuntary hold. Um, Under the Welfare and Institutions Code 5150, it does provide that the advisement to the patient is given. It must be in a language that the patient can understand. And it includes accommodations for disabilities affecting that communication. And we definitely want the individual to know that they're being placed on the 72-hour hold and that during that evaluation time, they could be transferred to another facility. Here's a copy of one of the involuntary patient advisement forms. We wanted to um, post that for you as reference. And it's really critical here to be able to provide that advisement in a language or modality that is easy for the individual to understand.
Okay, in the next section, section 7, we are going to be covering some additional considerations with regards to the involuntary hold process. So first, I actually mentioned this previously, but with regards to that historical third-party information, the certified hold writer will consider evidence that's presented by individuals who have provided or are still providing behavioral health or related support services to the individual. This includes medical records, psychiatric records, and this is if that information is available, because that is information that could again inform or support probable cause and also give more context to that evidence and impairment of observable functioning. And then also third-party information voluntarily presented by family members is also to be considered. And the individual who's being detained, they can actually designate an additional person to provide information. So they're like, oh, will you speak to this person? And as I mentioned earlier, that civil liability. So no one may give false information knowingly without being potentially liable to the patient in a civil action. So again, in other words, if probable cause is based on a statement other than that of someone who's authorized to take the person into custody, so a third party, if that person making that statement, if that person knows that they're giving false information and they provide it, and and the individual is placed on a detainment, then that person shall be held civilly liable for intentionally giving a false statement that led to a person being involuntarily detained. So basically led to an inappropriate hold because of their false information. With regards to cultural competency, what is cultural competence in crisis intervention? Well, it is the ability of the crisis responder or the hold writer to not only understand, but also to respect the diverse cultural beliefs, values, and behaviors of individuals who are in crisis, and then how those beliefs, values, and behaviors may impact or show up with regards to how this person experiences that crisis, because all cultures, different cultures define and perceive crises differently. And so being able to understand that, and not only understand that, but respect that, really speaks to, really supports the hold writer or the crisis responder in their ability to be able to provide that intervention. So why would that be important? Well, again, effective crisis response. So by understanding some of the nuances of understanding, maybe nonverbal communication, posture, tone of voice, proximity, some of these, vocal inflections, or just some of these other things, if a crisis responder understands some of the nuances about how to engage with individuals of different cultures or diverse cultures, that individual can better assess the situation and then tailor their approach to provide the intervention so that they get the best possible response, and that we ensure the person's safety and are able to really help the individual. Also builds trust, so demonstrating sensitivity to culture establishes a rapport, helps build trust not only with the individual but with communities, right? And then also kind of tying back into number one, providing effective crisis response. If we can establish trust, then we can better, assess the person and better provide those interventions, because that person will then have trust in the individual. And then lastly, of course, reducing stigma, help seeking stigma around certain agencies, law enforcement, government officials, mental behavioral health officials, social workers, by being culturally competent, particularly in these crisis situations, approaching individuals with respect for their beliefs, understanding, acknowledging, allowing space for those, can really help reduce the stigma that's associated with, help against help seeking behaviors in these situations, and then just, engaging with these different agencies in general with throughout the community. With regards to mandating reporting, so mental health and medical health professionals, peace officers are all listed as mandated reporters of child abuse, dependent adult abuse, and elder abuse. California state law mandates that a mandated reporter report knowledge of or reasonably suspected abuse of these protected categories. So if the hold writer or the designee who is conducting the assessment is informed of, like during that assessment process, information has been shared that indicates a suspicion of any abuse, any child abuse, dependent adult abuse, or elder abuse, and that person is still mandated to follow their obligations as a mandated reporter. So that mandated reporting obligation is still at play, even if there is an assessment for involuntary detention occurring at that time. So that's important for our hold riders to be aware of, and that's actually important for the communities and individuals as a whole. With regards to juvenile court jurisdiction, so this category includes wards of the court, so individuals who have violated a law defined as a crime and they're minors, or dependents of the court because their parents or their guardians have been accused of abuse, neglect, or abandonment. So juvenile court jurisdiction includes wards of the court and dependents of the court. So the juvenile court does not have the authority to commit minors except under the LPS Act, and the admission criteria is very similar. Obviously, danger to selves and danger to others, but then there's that distinction of gravely disabled with regards to that inability to utilize, although it's provided to them by other individuals. So when the court is in doubt as to whether a ward or dependent has a mental health disorder, the court can order the minor to be taken to an LPS designated hospital for evaluation. With regards to voluntary admission, so first specifically with minors, so the certified hold writer, it is up to the hold writer to determine whether the minor can be admitted voluntarily with parental consent, or whether to initiate the 72-hour involuntary detention. So remember, the 5585, sorry, specifies that the parent must be allowed to, a parent or guardian must be allowed to admit the minor voluntarily if it's already been established that that psychiatric intervention is necessary. So taking that into consideration, the hold writer also has to determine whether that can be that can occur safely. So there's also like kind of like that caveat where can the parent safely take the minor to the hospital, or can the parent safely initiate voluntary treatment? And then point two here says the only reason not to seek voluntary admission to a hospital is one, if the parent is unavailable, if the parent is unwilling, or if the parent is incapable of signing their child into the hospital, or if the parent requests, if the parent asks that the child be placed on an involuntary hold rather than signing the child in themselves. And you might be thinking, well, that's horrible. Well, in certain circumstances, it may not be safe for the parent to do that. Let's say if whatever the crisis is, maybe if the parent is the focal point, or the guardian is the focal point, or somehow possibly a trigger for the minor. And so if the parent is responsible for taking the child to the hospital, that might be an unsafe situation for the parent or the minor, or both. If the parent is unavailable, if the hold writer is assessing the minor at school, and the parent is, unable to leave work for whatever reason, or they're unable to leave home because they're small children and they can't be present to initiate that, to follow through with that voluntary, then the hold rider would go ahead and initiate that process. But the requirement is that the communication would take place, that the parent would be notified that this process is occurring. And then, or incapable, if there's a circumstance where the parent is incapable of doing so, or if they don't want to, if they disagree. Again, what I stated earlier, it's a matter of safety. It's already established that the minor is a danger to themselves, a danger to others, and or gravely disabled. And we've already, as a hold rider, you've already established that the minor meets the legal criteria. Even if the parent is unwilling, you as the hold rider are still legally able to initiate that involuntary detainment. With regards to requesting specific psychiatric hospital, parents are able to request specific hospitals where they want the minor to be admitted. However, as most of us know, that those requests may not always be possible. We may not always be able to honor those requests, but and even with the adult patients, they should be advised, or they shall be advised, that they can make the request to be treated or evaluated at a specific facility. However, it's not always possible to honor that, but it is expected that an effort will be made. And I think for hold riders, it's just important to know that we can't, tell a person that they can't choose. That's really the point there, is that they can request. It's just for the viewer and for maybe those in the community, it just may not always be possible. There are a lot of bed shortages. There's a lot that can complicate to being able to honor that request. So it's important that to know that the request can be made, but it's not a requirement to honor that request. It's an expectation that an effort will be made, but it's not always possible to make that happen. So with regards to voluntary crisis resources, it was important to point out here, and then I'll also reference these four facilities again when we get to our county resources. But SB 364 does require that a determination be made as to whether the person can be treated without being detained. So again, that spirit of least restrictive, we've established that, okay, criteria is met, intervention is necessary, hospitalization is necessary, but is the person willing to go and seek treatment? If they are, 5150 goes away, involuntary detainment goes away, and this person can pursue voluntary treatment. So we have the Merrill Center in Fontana, and we have the Windsor Center in San Bernardino. We also have the QUICS, which is the Crisis Walk-In Clinic in Victorville, and then the other in Yucca Valley. So if there are any additional questions, obviously this is a recording, so you can't ask me, but as much as I would love to answer your questions, I cannot on this present platform. However, if you do have some questions, you can submit them to the DBH-5150 questions at dbh.sbcounty.gov. And if you have any additional questions with regards to this process, if your question is related to becoming certified, again, I would have to direct you to your agency's 5150 contact. If your agency does not have a 5150 contact, that might mean that your location or your site would need to be authorized to have a hold rider, and so that is an additional process. So I would encourage you to seek out that information, and then you can use this inbox if you need it. So a couple of FAQs, or frequently asked questions, just to circle back on a few important areas. So an application for detainment for minors, 5585, can be done against the parent's wishes. Yes. So again, if it is established that hospitalization is necessary, that the minor meets criteria, legal criteria, as either being a danger to themselves, to others, or gravely disabled, and if the parent is unwilling, they disagree, the hold rider can initiate involuntary detention of the minor. Second one, there is a different standard and designation for a gravely disabled minor. Yes, so again, minors are not expected to provide for their own personal safety, for their own food, clothing, shelter, personal safety, and necessary medical care. So the gravely disabled definition for a minor is their inability to utilize these um, these five things, these five needs. So food, clothing, shelter, personal safety, and necessary medical care as provided by others. Number three, an application is not a guarantee that a person will be admitted into an LPS hospital. That is correct. It is not a guarantee. It is an application is an application. It is a way for it's a document that allows the hold writer to legally detain a person involuntarily in order to initiate that process. The application requires the completion of an advisement and notation of what language was provided on the form. I did not cover that specifically because that is part of the detainment, a specific part of the detainment process, and that's a part of the completion of the application. So for our certified hold writers, they will be trained on what is included in that advisement and then where the notation is indicated on the application. The next one, only county designated persons or peace officers can write an application for detainment. Yes, only individuals who are certified or designated by the county Department of Behavioral Health can write an application for detainment. So again, as I stated at the beginning of this video, just by viewing this information, although you have acquired all of this knowledge, the acquisition of the knowledge does not allow you to, does not designate you, does not authorize you to write a hold. You have to go through the certification process. And then also, I would even say you would have to start in determining if your site is authorized, and then if your site identifies you as an eligible person to write a hold. So there is a few steps that has to be taken for that. Next, any person who knowingly and willfully detains a person beyond 72 hours may be held civilly liable. So yes, this is upholding that up to 72 hours and upholding the SB 2275, which regards to when the clock starts, when the detention starts, and when it ends. The next one, the person writing the 5150 is responsible for safeguarding the property of the detainee. Yes, and also to note here, the personal property in the law includes children and pets, along with the personal actual, like, property of the detainee. Lastly, 5150 or 5585 may be supported based on the word of a third party. Yes, so the important word to note here is supported. So a 5150, 5585 cannot be written based solely on the word of a third party, but it can be written supported by the word of a third party. And that's where the information gathered by the hold writer comes into play. That party may be held liable for false statements. Yes, so civilly liable for any false information that is provided, which is why the truth and the whole truth and nothing but the truth is crucially important on this application because, again, legal process, legal document. And that is the end of our frequently asked questions section. In this next section, I'm going to be covering several pages of San Bernardino County resources and just some contact info, some really great phone numbers and contacts programs that you may not be aware of or you are aware of, but didn't know how to get a hold of. So that is what we will be covering in our next section. All right, so in this last section, we will be covering San Bernardino County resources. So I'll be going over several pages of resources that are available throughout our county. I might be going through them a little quickly, so if you need to pause the video to capture a number or an email address, please do so. And then again, you can find this information on the county's website. So first, we will be looking just kind of a revisit of those voluntary services. So we have our crisis residential treatment, or what is known as our CRTs. We have Casa Paseo Center, Wellspring Center, Desert Hill Center, and Morongo. I'm sorry, that says Moronga or Morana. It should say Moronga. Oasis Center. I'm so sorry. And then we have our crisis stabilization units. We have the Merrill Center, Windsor Center, as previously mentioned, and then our crisis walk-in centers, one in Victorville and then the other in Yucca Valley. Once again, we have our LPS designated hospitals listed here, ARMC, the Community Hospital, Veterans Hospital, Loma Linda, and Canyon Ridge. And again, the different populations, right? So the three on the left are adults, and then the two on the right are adults, adolescents, and then also Loma Linda with accepting the 12 and under as well. This is a list of our outpatient clinics within our county. So for the East Valley, we have Mesa Counseling Services, Phoenix Community Counseling Center, South Coast Community Services, Valley Star Community Services. For our West Valley folks, we have Mariposa Community Counseling, South Coast Community Services again, and there's two locations there, one in Upland and one in Chino. There's Vista Community Counseling and then West End Family Counseling. For the Desert Mountain area, we have the Apple Valley Community Clinic, Barstow Counseling Center, Family Services Agency, and it looks like there's one in Adelanto and one in Crestline. We have the Victor Valley Behavioral Health, Victorville Center, and then the Needles Behavioral Health Center. And then we have Lutheran Social Services, and there's three locations there, one in Trona, one in Lucerne Valley, one in Big Bear Lake. And then lastly, for the Morongo Basin, we have the Valley Star Yucca Adult Facility. For the East Valley, for recovery centers, we have the Cedar House Life Change Center, Rialto Behavioral and Addiction Treatment Services, the Inland Behavioral and Health Services, the IBHS, and then Phoenix Substance Use Disorder and Recovery Services. For the West Valley, there's Mariposa Community Counseling, the Clare Matrix, and then Inland Valley Recovery Services, the Upland Recovery Center. Continuing with the recovery centers for the Desert Mountain area, it looks like there's several. There's Apple Valley Recovery Center, Barstow Behavioral Health Center, the High Desert Child, Adolescent, and Family Services Center, High Desert Child, Adolescent, and Family Services Center. Oh, it looks like we got two there. Oh, I'm sorry. One is in Barstow and then one is in Victorville. Apologies. And then the other is in Yucca Valley. So there's three locations for the High Desert Services Center. And sorry, for additional services, just other services that kind of fall under different areas or levels of need. We have the EMQ, Children and Family Services, High Desert Child. Again, we've mentioned that one in Victorville. We have the Project Sister Family Services, which is the Rape and Sexual Assault Crisis Counseling Center. I also understand that they not only see the survivors, but also non-offending family members. So that's important to note there. San Bernardino Sexual Assault Services, Valley Star Children and Family Services, and then the two locations for Victor Community Support Services, one in San Bernardino and one in Victorville. Some additional resources, if there's any other phone number you grab from this presentation, this would be the primary one. It is our access unit, is the behavioral health helpline. They are available 24 hours a day, 7 days a week, 365 days a year. So if you have questions, if you're experiencing a crisis, if you need to be connected, the access unit is a great resource. It's probably the number that you didn't know you needed. So definitely write that one down. A couple of other numbers here for SARC, which is the Screening, Assessment, and Referral Center, Recovery-Based Engagement Support Team, which is the RBEST team, and then the Innovative Remote On-Site Assistance Delivery, which is the Inroads team. HOST and the HOPE team, those teams are actually connected to our Sheriff's Department, and they support those agencies. With regards to mandated reporting, I hope and pray you will never need to utilize this information, but if you do find yourself in a situation where a mandated reporting or a child abuse or dependent adult or elder abuse report needs to be made, this is the information. It is a separate phone number and separate process for children as opposed to the adults and the elders. And then you have the phone numbers there. I know that you can't click on the links here, but you could possibly pause and copy. And there's certainly, if you Google it, you'll be able to find the information there. So, lastly, I just want to do some quick announcements. I want to shout out, if you will, our Orange County Healthcare Agency Quality Management Services for their contribution to the development of this presentation and to the training presentation as well. And of course, my team, Workforce Education and Training, for putting this presentation and the content together. And certainly, again, last but not least, just a couple more resources. These are probably the most important phone numbers here, so they're put up here for your convenience. So with that, I would like to say thank you very much for taking the time to view this video and to access this information. I hope that it has been helpful to you. I hope that if you had questions, they've been answered. And if they haven't been answered, that you now know where you can go to get those answers. Again, my name is Denetra Lee, and I just want to, wish you all well. And thank you so much for sharing this time. Take care. Bye.